Welcome to the Deep Dive. It's Monday, July 7th, 2025, and we're here to help you get truly informed on today's biggest AI stories. And what's really interesting today is that this whole deep dive, we're calling it AI Daily Deep Dive, was actually researched and, well, generated entirely by AI.
It really was. It's quite something.
Yeah, it's sort of AI looking at AI's impact.
Exactly. And it shows how fast this is all moving, from just ideas to, well, real stuff happening. It's touching everything now. Healthcare, movies, sports, even personal well-being. Today's stories really hit that home.
Okay, let's get into the first one. This sounds pretty huge. Google DeepMind spinoff, Isomorphic Labs. They're apparently about to start human trials for drugs designed by AI.
That's right. It's a big step. Isomorphic Labs started back in 2021, part of Alphabet, with this incredibly ambitious goal: solve all diseases.
Wow.
Yeah, and they're using an AI drug design engine. The key piece is AlphaFold 3. You might have heard of it.
Vaguely, yeah. Protein folding, right?
Precisely. It predicts protein structures, how molecules interact, with amazing accuracy. It basically cuts out a ton of the old trial and error in finding new drugs, their first trials. Focus on cancer therapies.
Okay, so this could massively speed things up.
That's the idea. It could fundamentally change how we develop medicines. Maybe even make it faster to tackle diseases we thought were, almost impossible.
Are people worried, though, about AI doing this? Or regulators keeping up?
Oh, absolutely. That's a huge question. The tech is moving so fast, and, well, the rules and safety checks need to race to keep pace. There's massive potential, but also, big questions about oversight.
Right. Okay, moving from medicine to something. Well, maybe a bit weirder. The idea of using AI to bring back dead actors, like Marilyn Monroe in new movies.
Yeah, that's definitely stirring things up. There was a piece by Mick LaSalle digging into this.
Mm-hmm.
He talks about the ethics, calls it a kind of virtual hell, creating performances without consent.
Virtual hell. Strong words.
They are. And it taps into bigger questions about, like, who owns a performance, artistic integrity. We saw similar debates around potentially using AI for Kevin Spacey's performances.
Right.
The feeling seems to be, though, that the market might actually be quite hesitant. People still value, real human creativity and the artist actually agreeing to it.
So the tech might be there, but maybe audiences aren't quite ready to embrace digital ghosts just yet.
Seems that way. It suggests there's still a line, perhaps, when it comes to AI and art.
Okay, so AI is causing debates in Hollywood, and it seems on the tennis courts, too. Wimbledon's new tech isn't going down smoothly.
Not entirely, no. They rolled out an AI electronic line calling system, ELC, for 2025, and some top players are really not happy.
Like who? What happened?
Well, Emma Raducanu pointed to a specific call she said was wrong, and Replay backed her up. Jack Draper just flat out said he wasn't sure about its accuracy. And Ben Shelton had a match where the system actually failed because there wasn't enough sunlight. They had to scramble.
Not ideal in a big match.
Not at all. And, crucially, there was an issue for a deaf player who needed the human line judge's hand signals. The AI system just didn't account for that accessibility need.
Oh, wow. That's a big oversight.
It is. Wimbledon blamed one incident on human error in operating the system, but the overall reaction shows how tricky fully automating these things can be. It reminds me a bit of Klarna, the finance company. They tried automating customer service with AI, then ended up having to rehire people.
So the human touch, or at least human oversight, still seems pretty vital, even with smart tech.
It certainly seems that way, especially where fairness and human needs are paramount.
Okay, last story in this one. Well, it surprised me. People using AI chatbots as guides or trip sitters for psychedelic experiences.
Yeah, it's definitely out there. We're hearing stories like a first responder named Trey using an AI journaling app called Altered during a high-dose LSD trip. He felt it helped him work through alcoholism.
Really? An AI app?
And another person, Peter, apparently used ChatGPT to help him prepare for taking psilocybin.
So what's the appeal?
Well, the AI is always available, 24/7. It's cheaper than a human guide, obviously. And it can offer, seemingly personalized insights based on what you tell it.
Is that safe? I mean, seems risky.
That's the huge concern. Neuroscientists are waving red flags. They warn that AI just doesn't have emotional understanding, that human connection.
Right.
There's a real risk it could make things worse, maybe reinforce delusions, or even potentially trigger some kind of AI-induced psychosis.
Yikes.
Exactly. So while it looks helpful on the surface, private, accessible support, that lack of real human empathy and judgment makes it, well, a pretty precarious frontier. Promising maybe, but Definitely risky.
So across the board today, medicine, entertainment, sports, even mental health AI is pushing in, creating these amazing possibilities, but also some really complex challenges.
It really is incredible, the range, from designing life-saving drugs to, well, guiding psychedelic trips. And it leaves us with a big thought, doesn't it? As AI gets deeper into these really personal, really high-stakes parts of our lives, where do we draw the line? How do we balance embracing all this progress with, holding on to what makes us human, our judgment, our empathy, our connection?
Something for you to definitely think about. We'll be back with another deep dive soon. Thanks for joining us.